The Postal and Regulatory Authority of Zimbabwe, Potraz, has managed to sign a significant deal with the International Telecommunications Union, ITU, where we witnessed the Potraz Acting Director General, Mr. Zimbabwe, here with us, signing with the ITU Director BDT. And we're just going to be talking a bit much in detail about that. And to you, Mr. Sireo, thank you so much for taking your time to join us here on our short YouTube video.
Thank you.
Right, in general, we understand that there's been a signing with men that I'm not allowed to say. I know I can't properly pronounce his name. I think you can help our viewers, they fully understand what was happening, whom did you sign this with, and generally on that concept.
Okay. Thank you very much. Yes, Potraz went into a cooperation agreement with the International Telecommunications Union through its Telecommunication Development Bureau to implement a telemedicine pilot project in Zimbabwe. Signing on behalf of Zimbabwe was myself, Baxton Sirewu, and signing on behalf of the ITU was Mr. Brahima, who is the Director BDT, or Telecommunications Development Bureau.
Basically, what does this mean for us Zimbabweans to have this telemedicine project, especially to the rural people who don't know what the internet is?
Thank you very much. I think connectivity without the relevant applications is futile. That is one principle that we are working from. We need to provide connectivity and provide relevant applications that transform lives, whether lives in rural areas or lives in urban areas. In this particular case, we are using the health platforms to transform lives in rural areas and to provide quality healthcare services in rural areas. So this is an intervention that I could say is coming in at a time when Zimbabwe is facing some problems when it comes to the provision of healthcare services in rural areas. We have got the shortage of doctors on one hand, and also we have got high levels of mortality in certain areas, be it child mortality and mortality at birth and all that. All those indicators for us are not looking good. So ICTs can be a key enabler that can help us reverse that negative indication coming from the indicator.
So when was this implemented, or it's yet to be implemented in Zimbabwe? Which places per se in Zimbabwe, like cities or rural areas, have this program been implemented?
Thank you very much. The signing took place on the 25th of November 2015 in Geneva.
2 weeks back?
2 weeks back. Yeah, we took advantage of our delegation being there in Geneva for the World Radio Conference. So we took advantage of that event to sign the agreement. So the signing of the agreement is a major milestone in that it marks the beginning of the implementation phase. So I could say the project hasn't started, but we are now in the implementation phase.
The preparedness of us as a nation, how prepared are we? What are the costs that we are looking at for us to actually start this program to be rolled out?
Thank you very much. This project, I should say, is a pilot project. It's a project that will cover 12 rural clinics and 2 district hospitals, a provincial hospital, and a referral hospital, Barilenyatwa. The pilot project has got a number of deliverables, which will then leverage on going forward in scaling up the telemedicine project to nationwide coverage. So what we are really looking at is, number one, the development of protocols, policies and regulations, as well as standards for telemedicine in Zimbabwe. We are also looking at deploying starting with those 12 clinics, deploying and learning from the deployments that we would have made. And amongst the services that will be provided include live consultation, where the doctor will be based at the district hospital, but conducting live consultations at the remote rural clinic. And they will be providing...
Do we already have that infrastructure that can allow that to happen, or where it to...
The provision of infrastructure is part of the project.
Okay.
In total, the project will cost, the pilot project will cost about 400,000. But that is excluding what Potraz would also come in with in terms of manpower and local resources. And it also excludes what the ITU will bring in terms of expertise and the resources that they will chip in other than financial resources. So the financial resources that have been put in place amount to 400,000. Yes, for the 12 clinics, 2 district hospitals, and a provincial hospital as well as public.
All right. Do you have exact places and areas, these 12 clinics, have you managed to identify the actual areas here in Zimbabwe that you're going to be launching this?
We are working with the Ministry of Health and Child Welfare to identify the clinics. Tentatively, it has been decided that maybe Manicaland will be the province that will provide us with those clinics that will pilot this project. The main reason being that like in Nyanga, they had already started on something.
On the telemedicine project.
The telemedicine project.
Yes,
so it will be like
Dr. Jukwiro.
Dr. Jukwiro, yes. So we are just going to upgrade the systems that he has put around the Nyatate and all the other areas. And then we take it up to some scale that is of international standard.
And then on that note, how costly will this be, especially to the rural people? We know the expenses that are associated with bandwidth, the internet services. And then when I have to communicate with a doctor, yet I'm in Nyamapanzi, there deep down in the villages, how costly will it be to me as the patient?
For the pilot phase, Potraz will provide everything, the infrastructure as well as the bandwidth. The pilot will be used to study the cost implications and sustainability of such a solution for rural service provision. But what I should say is, like the project that we were talking about, which was undertaken, or which is being undertaken by the Nyanga best doctor, Dr. Jukwiro, you would find that according to his statistics, the number of reviews or review patients visiting Nyanga Hospital was reduced by about 60%.
Wow.
So that's a big saving in terms of transport cost. And also
that means they no longer need to move from Nyanga to go to Harare, and then they're seeing a specialist. They're just doing it online.
Yes, the review just takes place at the remote clinic. The doctor will be online and the patient will be online, and the doctor will instruct the nurses accordingly.
And then there's always the question with the situation in Zimbabwe of electrification. How well prepared are you? Since this is still the pilot stage, there is no electrification in rural areas most of the time, and then there are going to be more severe cases that will need immediate attention. How are you going to look at that?
The project is actually, the project will be implemented in 4 phases. And phase 1 of the project includes an infrastructure audit. So we will, after the identification of clinics by the Ministry of Health and Child Welfare, we will then conduct an infrastructure audit. And through that audit, we will then establish which clinics would require alternative energy sources like solar energy, and which ones are supported by commercial electricity. There are so many remote areas that have access to electricity, but that are not benefiting from or leveraging on ICTs. So we think even at this point, there is scope in us working together with RIA in certain areas to make sure that they come in first and we come in with ICTs. But I'm sure the pilot itself will clarify all these issues.
All that we have from the current ongoing deal between Zimbabwe and the International Telecommunications of either Telecommunications Union, ITU, whereby we are witnessing yet another innovative way of embracing technology in Zimbabwe.